so let's go on your back first with your head down here. And just scoot over towards me a little bit. Okay, so we do this, again, in the classes, we do a good amount of time with this, looking at how people roll. Okay, and there's a lot of inefficient movement patterns with rolling that you see. And I mentioned that article that talks about how much that carries over to upper extremity and lower extremity functioning, especially with athletes. But rolling is a huge thing to work on, even with your orthopedic athletic population. Okay, so let's just see, without thinking about it, and you're not going to go real far, just go onto your side. I want you to just roll onto your side from there. Okay, so she did pretty well with that, and we do a lot of looking at how people do things. Go ahead, back. Okay, and I know you heard me talking about it this morning already, so go ahead again. Okay, so the only thing that I see that I would want to change with this is she does a lot of driving with the arm just reaching across, and there's a lot of rotation that comes into that. Okay, we're not going to pick on a whole lot as far as the rolling, but I want to show you how I would train the most efficient rolling response. So let's go onto your side now. Okay, and I want you to scoot your hips back towards me. Actually, bring your shoulders back towards me too. Okay, so all the way, just sit with your back here. Okay, so I mentioned this morning about the most efficient rolling pattern is anterior elevation of the pelvis with anterior depression of the scapula. Okay? We know, I'm going to jump up on here so I might not be on camera for a second, but we know that when babies are learning how to use their trunk and how to use their core, okay, what do babies do? They're here, okay, and they start coming up a little bit, then they start lifting a leg up, and eventually what do? They start reaching, and then they know how to roll. That's how we learn to use our core. That's the first place that we learn neurodevelopmentally to use our trunk, is we start coming up and we start trying to roll to come here. Okay? So if I have a patient who has their core is very inhibited, they're not moving well, why not put them in the position that we learn how to use it? So a lot of times we'll do rolling training just for trunk resistance. Okay? So what this looks like, if I have you, I'm going to have you just knees bent. Okay? So right here. Now, I talked about hips, shoulders, and the diagonal. Right now, if I'm going to be resisting anterior elevation of her pelvis, anterior depression of her scapula, that doesn't work. I can't be in both places. So this is the one time that I mentioned this morning that when in doubt, your forearms have to at least be in the pattern. Okay? So what this looks like is that if I have you, and I'm going to set your scapula here, and I'm going to show you with a couple different grips. I'm just going to hold on to you right here. Okay? This hand is going to come on right here. Okay? So what a mass flexion rolling pattern looks like, and I'm going to do some rhythmic initiation to take you through it first, is you're going to come up into anterior elevation with anterior depression right here. Okay? So let me move you. We're coming right here as you're curling up. Okay? So now I want you to start doing this motion with me. Okay? Now I'm going to do some resistance. Ready? I want you to pull up and let it come back. And pull up and come back. Pull up and come back. I'm just going to scoot forward a little bit so you don't feel like you're falling off. I can also come here and just show you a different grip with our elbow, and I can get a little bit better handle. So I'm going to bring you back. Now I want you to curl up. Good. And let it come back. And curl up and back. If you look at where my forearms are, curl up, I'm still in the pattern. So hold here, hold it. I'm still in that anterior depression pattern and the anterior elevation pattern, just trying to resist her. Okay, let it come back and curl up. So that's our mass flexion of combined trunk patterns. Okay? Sometimes, and don't worry about this because we haven't done extremities yet, if I really want to get her whole body working for this, I'm going to bring your arm back and your leg back here. Okay? Now, as you're doing that, what I'm going to have you do is you're just going to curl up this way so I can get the arms and legs in too. Go ahead and curl up here and let it come out. Curl up, and let it come back. Same idea, curl up. She's just getting arms and legs going with it also. Okay? So that's mass flexion. Mass elongation is if we're trying to get someone to roll from prone to side lying or to supine. The patterns for mass elongation are the opposite. It's posterior elevation of her scapula with posterior depression of her pelvis. So we're really getting length coming to right here. Okay, so I can either work with a proximal grip, but I can only do that in a relatively short range. So if I come in here, I'm on our ischial tube, and I'm right here. And first I want you to just hold it. Don't let me push it together. Hold it. Just hold it. Hold. Good. Now I want you to push out against me, and I'm going to let her come about this far, and now let it curl up. And push out against me. So I'm working some elongation of her trunk. If I'm going with my proximal grips here, that's about as far as I can go with it. And this is beyond what I'm going to have you guys all practice and what I'd expect you to be doing in the clinic. But I just want to show you how we go to the next step with this. If I'm going to go arms and legs, and I really want to get length on her side, so I'm going to bring your arm here. And all I'm going to have you do now is as you reach your arm up, your leg's going to come back to here. Okay, so go ahead and reach up. Good, and back. And reach up. Good. And reach up. Good. Reach up. I can do reversals. Good. Now curl up. Good. And reach back. And curl up. So we can do lots of different things with it. But what I want you guys to at least practice for a few minutes is mass flexion. Okay, because that's one that we use all the time in the clinic. So have your patient get in this position. You can either go here with your contact or here with the elbow and right on their pelvis, and just work first at an end range hold. Okay, so first just hold it here. Don't let me pull you apart, and all I'm trying to do is pull her out. Okay, so hold it here. Good, and now I can just have you slowly let it come out. Let me bring it out. Good, and now curl back up. Good, and let it come out, and curl back up. Okay, so that's mass flexion. All right, let's take a few minutes and practice that, and then I'm going to show you another